Dr. Murthy is the United States 19th Surgeon General and the first Indian American to take that office. He is the son of immigrants and a true public health hero who has devoted his life to improving the country's health through the lens of service, clinical care, research, education, and entrepreneurship. Like the Health Forum, Dr. Murthy understands why a health in all policies approach is needed to create healthy communities. He once said, public health does not exist in a vacuum. It is intrinsically linked to education, employment, the environment, and our economy. There's a whole world beyond hospital corridors and clinic waiting rooms where people are struggling with issues of transportation, housing, and development. His office also just released a cool new video on the importance of walking and walkability that I encourage you to all see. I also hear he has a video with Elmo, and he knows Elmo, so that's cool in certain circles. He is our nation's leading voice for health justice and a friend of the Health Forum, so please join me in welcome Dr. Vivek Murthy.
Thank you so much, Ria, for that kind introduction and for outing me about my relationship with Elmo. And thank you all so much for having me here today. My first encounter with the Health Forum was a couple of years ago when I met Kathy Cochin, your fearless leader, at a conference and had the chance to sit down with her a few days later and talk about the extraordinary work that the Health Forum does for our country. And I will say that since then, the people I've met in the Health Forum, the things that I've learned about the Health Forum's work have only increased my admiration and appreciation for this great organization and for everything that you do. You know, the things that you do, some of them have been well publicized, I know, among the API community, but there are many things that you do each and every day to strengthen the community that a lot of folks probably don't see. But I know that all of what you are doing, that your mission is dedicated to creating a foundation for health, not just in the API community, but for all Americans, and I thank you for that. You know, in particular, I'm thinking about some specific contributions that you have made that are on my mind. One of them is the critical role that the Health Forum played in laying the foundation for the White House initiative on APIs. You did that many years ago, but the dividends that have paid from that initiative have been great. And I am so honored to have the opportunity to co-chair the initiative with Secretary Arne Duncan. And all of this would not have happened without your support and your leadership years ago. I'm also thinking about the 850,000 plus folks that you helped recruit and enroll in our community for health insurance coverage over the last 2 years. The work that you did outperformed enrollment in essentially every other sector. It was unexpected, it was extraordinary, and thanks to it, there are thousands and thousands of people who are benefiting. We know that health insurance saves lives. That information and that science had been documented well before the ACA passed. But since the ACA has passed, we have also seen that people with health insurance are more likely to utilize preventive care services than people without insurance, dramatically so. And because of what you did, more and more people across America are not just getting access to treatment, but also to prevention. And you are quite literally changing and saving lives as a result of that. I also want to thank you for keeping a few important items on the agenda of folks here in Washington, D.C. And those issues are around language access and around the importance of data. As you know better than anyone, language serves as an unfortunate barrier for too many people in our country to getting health care, to accessing knowledge and education and information about how to stay healthy, and to accessing services in the end. But what you are doing to continue to push the envelope on ensuring that our services are available with the appropriate language access, to ensuring that we also have the data to understand what is happening in our communities, that push is essential. And my hope is that you will continue to push that message in Washington, D.C. and in local communities across this country. But more than all of these individual actions, I want to thank you for a fundamental value that you have continued to push forth in our country, and that's a value around equality. This country was fundamentally built on the notion that everyone, regardless of who they are, should have access to the same rights and privileges. Health falls into that category, although that has not been the story of America. We have great disparities when it comes to health. When it comes to health, we are not living in a consistent fashion with the values that lie at the heart of our country. But what we have been doing in recent years, by ensuring that we are enrolling more people, that we are shining a light on important health disparities, is helping to bridge that gap between who we want to be and who we are. And that is in part thanks to the important effort of groups like you. So I thank you for all of these contributions that you have made and that you will continue to make, because I know that our work is not done. And as I also look out at you, at faces that I know, at folks who I don't know, I realize that all of us come to this conference today with our own unique stories of how we either arrived in this nation, our parents, our grandparents, but somewhere a few generations back, each of us has a story about what brought us to this extraordinary nation. And I'm reflecting a bit and thinking a bit about my own story. My parents came to this country when I was just 3 years old. They left India in the 1970s for the same reasons that many other immigrant families did. They were looking for better education and opportunities for their kids, for my sister and me. And they were not disappointed, because they came to a country that was generous, that was kind. But that's not to say that their journey was easy. They settled in Miami, Florida, where they didn't know anyone. They had very little in the way of resources. They encountered challenges along the way. I remember encountering a fair amount of racism when I was in elementary school and middle school, from kids who were good at heart but who didn't understand who I was and what our strange culture was all about. I remember also the folks that would interact with my parents in their medical clinic. My father is a primary care doctor. My mother doesn't have formal training in medicine, but she built and ran my father's medical practice, and they were true partners in caring for the community. And I remember the people that would come into their office, the patients who would come in feeling ill, feeling worried, feeling stressed, and who would leave feeling a bit better and knowing that they had a partner in their healing. I remember the gifts that those patients would give them over the winter holidays. And as a child, I didn't understand much about the sciences of what was going on. But there were little cues that I would pick up on that would tell me that these relationships that they were building with patients were truly special. I remember going over to some patients' homes for dinner when they would invite my family. I remember talking to them in the waiting room a few minutes before they would go into their appointment. And I remember some of these characteristic gifts around Christmas time, the 10-pound bag of pistachio nuts that one of their patients would reliably give them every Christmas, the life-size model chocolate foot that another patient would give them, that my sister and I would diligently chip away at between Christmas and New Year's until it was all gone. And all of these were symbols, in many ways, of the love and respect and kindness that embodied the relationship that my parents had built with patients. It was a relationship that they had built with their community. And that stuck with me. It inspired me to want to go into medicine myself. It inspired me to want to build those same types of relationships with people and to provide a source of healing and help to those around me. It inspired me to want to be a part of my community in a way that I hadn't known before. And so that's what I did. I became a physician following in their footsteps and their example. And I had extraordinary experiences building great relationships with patients, but I also realized two disturbing things along the way. One is I realized that many of the patients I was treating in the hospital had conditions that could have been prevented. And time again, treating diabetes, treating heart disease, treating cases of addiction and abuse, I saw that we could be doing better in keeping our people healthy in the first place so they did not have to suffer and their families along with them. But the second thing I realized was that there were great inequities in who actually got sick. That illness and disease and the hardship that came with them were visited far more frequently and with greater intensity upon some people rather than others. And that stuck with me as well. And when I had the great honor of being sworn in as Surgeon General, I remember these two key lessons. these two issues that haunted me and so many providers when we gave care to patients, the issues of prevention and equity. And that's why, as Surgeon General, these two form the foundation of my priorities. My goal as Surgeon General is to help build a culture of prevention in America, and it's to do so rooted in a foundation of health equity, where we understand that the benefits of prevention and treatment should be accessible to everyone in this country, regardless of where they're from, what they look like, or how much they earn. There are a number of initiatives that we will roll out in the coming months from my office. We've already launched an initiative around walking and walkability, and I'll say just a word or two about this. When you hear about walking, you might initially think, God, that sounds really boring. But the truth is, walking is actually a window into so much more. Walking is something that we share, something that all of us can do, whether it's with our own feet, with a wheelchair, with a cane. We all have the ability to move to one extent or another. But what is fascinating is that this tool, which we have had for millennia, it turns out to be one of the simplest but most powerful tools we have to turn back the tide on chronic disease. Diseases like diabetes, heart disease, arthritis, cancer, illnesses which are claiming 7 out of 10 deaths in America, and which are costing us over $1 trillion in healthcare costs each and every year. Not to say all the pain and suffering that they are causing. But walking, it turns out, is an extraordinarily important tool that we can use, and an average of just 22 minutes a day of walking can help reduce your risk of heart disease and of diabetes. If you're able to walk even more than that, if you're able to get up to 300 minutes of moderate physical activity a week, you could even start to reduce your risk of certain cancers. All of this are things that we can do just with walking. We can improve our energy and reduce symptoms of mental illness when we walk on a consistent basis. There are few tools which have such a variety of impacts and which are so simple in their implementation. Yet that's what we have. But walking also raises an important health equity issue, which is that not all people live in neighborhoods where they can walk. I remember a young woman I cared for in the hospital years ago who came to us because of a skin infection. She had dealt with obesity and with diabetes early on in her life when she was just in her teens. And after dealing with that as a teen, she started to develop these infections on her leg, something that's unfortunately not uncommon for people who are living with diabetes. The first infection was easy to treat. She went to her doctor, she got some oral antibiotics, and within a few days she was back to normal. But then she started getting second and third infections. The infections became more and more difficult to treat with oral antibiotics alone. She ended up having to go to the hospital eventually for intravenous antibiotics. The antibiotics, the bacteria that were causing the infections became more and more resistant, and she required more and more powerful antibiotics to treat her. And by the time I saw her in the hospital, she had an infection that was so severe that even with IV antibiotics, the infection had spread to her bloodstream. She had become septic. Her blood pressure had fallen critically low, and she ended up in the intensive care unit close to death. Now, fortunately, she was able to turn around with the aggressive help of doctors, nurses, antibiotics, IV fluids, and a lot of intense care. And when I saw her, I realized that I was seeing a woman who had dealt with so much, and the scars of which could be seen on her legs. But there were also deep scars inside that couldn't be seen from a lifetime of dealing with chronic illness that marked her childhood experiences as well as her adult experiences. And sitting and speaking with her, I talked to her about her diabetes, about her obesity, how had she sought to manage these in the past. And she told me how doctors had told her that she should go out and walk, that she should be active, that that's a way to help reduce and lose weight, and that walking after dinner is actually a great strategy. But what they didn't realize was that for her, walking outside in her neighborhood meant taking the risk of getting mugged or being shot. And so, given the choice, she chose safety over walking. 3 out of 10 people in America live in neighborhoods that don't have adequate sidewalks. Too many neighborhoods in America don't have the infrastructure for people with disabilities to go out and be active. That lack of investment in infrastructure, which is also a lack of investment in prevention, actually ends up hurting us later when more people get chronically ill. This is how important walking and walkability are. And it's just one example of the type of campaigns that we will launch over the coming months in collaboration with partners in the community, in the business community, in the nonprofit community, and across the country. I want to say that share a couple last thoughts with you, and that's a few thoughts about disparities. You know, I've talked a bit about how disparities in health were unveiled to me very early on in my practice of medicine. I've spoken to you about how it informs the work we do in the Office of the Surgeon General. But I want to emphasize again just how important the work that you do to shine a light on these disparities for the whole country actually is. Because many people in this country don't realize that there are still great health disparities that we face. Many people equate coverage with equity. They assume that because more and more people are getting coverage, that means that health is going to improve for everyone. And we know that coverage is essential, but on its own not sufficient to be able to erase the inequities that have persisted for generations in our country. And these inequities all of us see. They exist in many communities, but they also exist in the API and Native Hawaiian community. They exist when we look at the numbers of women with cervical cancer, who exist at a disproportionate number in the API community. And we also know that far fewer women get screened in the API community than in the general population. We know that the rates of hepatitis B and stomach cancer are dramatically higher in our community. We know that Asian American and Pacific Islander women are the most likely of any ethnic group to be the victims of domestic violence. We know that Asian American women above the age of 65 have the highest rate of suicide compared to anyone else in the population. These disparities are real. They exist in our families. They affect people we love, and ultimately they hurt all of us. And that's why the work that you do to shine a light on those disparities, to help people understand around the country, both in DC and in state houses in all 50 states, the work that you do to help them understand that our work is not done until we eradicate those disparities is really critical. It's so important. I know that addressing these disparities is not easy. Talking about them is far easier than addressing them. But the work that you are doing to educate the community and to cover more people, these are two important first steps in addressing disparities. And we must also address the social determinants that drive these disparities. The factors around education, around infrastructure, like we spoke about earlier with walkability, around transportation, and yes, around poverty as well. Because we know that these drivers fundamentally impact people's health. And that's why it is so important that in the initiatives that we build in our office, in the initiatives that you run, it's important that we bring together sectors that don't traditionally think about themselves as having to do with healthcare, but have a big impact on health. It's important that we talk to transportation professionals and officials and help them understand that the decisions they make can have fundamental impacts on the health of their community. It's why we have to work hand in hand with law enforcement to build safer communities where violence is less of a problem and less of a plague than it currently is for too many communities across the country. I'll share one last thought with you, and that's a thought that I had last week when I was at the White House for the 25th anniversary event of the Ryan White CARE Act. Some of you may remember what our country went through in the 1980s with regard to HIV. Some of you may remember the confusion, the fear, the sense of hopelessness that so many people had when they realized that our country was confronted with something that was dangerous but that we could not get our arms around. And in the wake of that fear and worry, there were communities that were discriminated against, that were misunderstood, that were vilified in some cases. But there were a group of people in this country who realized that we had to step up and help the community, that we had to not only understand what was going on when it came to HIV, but set the country on a path to addressing the healthcare needs of those who were impacted, and to do so effectively and without judgment. And that day, as I sat in the White House, looking at Ryan White's mother, looking at the senators and congressmen and staffers who had helped shepherd this bill through, looking at the community advocates who had worked hand in hand with those congressmen and staffers, I realized that that was an extraordinary community effort that came together. To give you a sense of it, the staffers there mentioned, often with tears in their eyes when they spoke that day, that they worked with many advocates who were affected by HIV, who were in fact dying as the struggle for legislation was going on. They would meet to talk strategy and to mourn the loss of their friends who had just weeks earlier been sitting with them to plan about how to get this legislation done. It was extraordinarily moving to hear those stories. But now, 25 years later, they look back on those struggles. They look back on what they were able to do, and they can see just how much change and impact this has had on the country. They can see how over 500,000 people have gotten care with HIV because of the work that they did. They can see that even more than those numbers, that they helped change the minds and the hearts of Americans all across our great country because they stood on principle. When we look back in the future at this time, where we had an extraordinary opportunity to transform health, I want us to be able to look back with that same sense of passion, gratitude, and hope. I want us to be able to look back on the efforts and conversations we had today. I want us to be able to take solace in knowing that even despite the great odds that we faced, the incredible health disparities that were in front of us, that we never gave up, that we were steadfast in our commitment. And I want us to be able to know that even in addition to all the lives that we changed in terms of better health, that we helped to reinforce one of the most important core values of America through our work, a value of equality, a value centered around the idea that everyone, regardless of where they come from, deserves a good shot at a healthy life. So that's the opportunity that we have today. That's the opportunity that you have seized. And that's the opportunity that we have to continue to work at so that we can make good on that promise of America, not just for us, but for our children and for future generations to come. Thank you so much for having me. Thank you so much for the great work that you do.